Hello, Professor. Uh, Hello, everyone. My name is Kaveri Pal, and this presentation focuses on how population health management or uh, population health management aligned with the business model canvas framework. This assignment is based on the week 2 requirements for HIT 600, and I will be walking through how this technology impacts different areas of healthcare operations, business strategy, and stakeholder value. I selected population health management because it's one of the fastest adopting technologies in the Gartner Hype Cycle for healthcare players and plays a major role in shifting the healthcare system from reactive treatment to proactive data-driven care. Over the next few minutes, I will explain what PHM is, how it fits into the nine components of the business model canvas, and why it has the potential to reshape healthcare business models, also, especially under value-based care. So, before we get into the business model canvas, I want to briefly explain that this presentation will cover. First, I'll give a short explanation of what population health management that is actually means and why it is becoming so important in the US healthcare system. Then I will connect a business creates, delivers, and capture values. After that, I'll show how PHM influences each of my 9 BMC sections, like such as key partners, value propositions, and revenue models. I will also discuss whether PHM in changing current healthcare business models and who benefits the most from this technology, including patients, provider, payers, and public health agencies. Finally, I will end with a summary and supporting academic reference. Yes, now it's population health management, and what is it? Okay, population health management is a strategy that uses data analytics to improve health outcomes for a defined group of people instead of treating patients one by one when they get sick. And population health management actually focuses on preventing illness, like identifying high risk populations early and coordinating care across multiple providers. And also, this system gather data from electronic health records, insurance claims, lab results, and even social determinants like housing or, as like you can say, income. This data helps organizations predict which patients are likely to develop conditions such as diabetes or heart diseases, so they can intervene like before complications happen, and is especially important in value-based care models where providers are rewarded for quality outcomes instead of number of services performed. That's why this population health management is rapidly becoming a core requirement for hospitals, payers, and government programs like Medicare Advantage. Yes, now it's business model canvas. Yes, Professor. It's the business model canvas is a framework used to evaluate how to product or organization create value. It includes also 9 sections such as key partners, uh, activities, value, positions, customer segments, and so on. In this presentation, I will apply each section of the BMC especially to population health management technology. The goal is to understand not just what it is like, but how it fits into real business operation in healthcare. I also connect this to figure 4 from the business architecture article, which shows how business strategy, information system, and organizational processes work together. By mapping PHM to the business model canvas, it becomes easier to see how this technology affects not just clinical care but also budgeting, data strategy, reimbursement models, and long term revenue. Now it's about partners, activities, and resources. These first three sections of this business model canvas are key partners, key activities, and key resources. For this, the key partners usually include EHR vendors like Epic or Gartner pair, like organizations Value Cross, data analytics, complaints, companies, and cloud service providers such as Amazon Web Services also. The key activities include collecting and interrogating large data sets, running predictive models, managing care teams, and also generating reports for value-based and also as per key resources, this one requires software platforms, patient registers, and secure data warehouse and trained staff such as data analyst. In IT specialist and care coordinators, these three areas highlight that population health manager is not just a software product. It is a coordinated ecosystem that depend on technology, data, and people working together. Yes, now it's value customer channels. Now I'll walk through the next three areas of the business model canvas like value proposition, customer segments, and channels. The main value proposition of population health management is that it helps organizations move from reactive care of proactive and preventive care. Instead of waiting for patients to show up in emergency room, providers can identify risk early and intervene sooner. This leads to fewer hospitalization, better patient experience, and lower overall cost. The main customer segments for PHM include payers like Medicare Advantage plans, provider organizations such as hospital and accountable care organization, and even government health programs that monitor population trends. In term channel, these platforms are usually delivered through cloud, dashboard, patient portal, mobile apps, and integrated EHR system. These channels allow data to reach the right people, whether that care manager, a physician, or the patient directly. The next three sections of the canvas are customer relationships and cost structure and revenue streams. Customer relationship is PHM are built around continuous engagement, the not one-time transaction. For example, these systems send alerts to care teams when a patient's risk score changes or when a diabetic patient has not refilled medication. This supports long-term relationship based on outcomes, not encounters. On the cost side, population health management requires technology investment, cloud storage, and cybersecurity, IT staffing, and training. It also requires cultural changes within organization, which can be expensive and time consuming. Revenue streams come from software as a service subscription, shared savings, contracts, analytics, counseling, and consulting, value-based reimbursement models like bundle payments. In many cases, Population health management becomes profitable when organizations reduce avoidable hospital admissions or qualify for government incentive payment. How population health management changes healthcare business model? Yes, Professor, this is closely tied to the shift from free for service to valued based care. In the traditional model, hospitals were paid based on volume, the number of tests, visits, and procedures performed. This supports the new model where organizations are rewarded for keeping patients healthy and reducing unnecessary spending. This means healthcare organizations must rethink how they use data, how they coordinate teams, and how they evaluate financial risk. Instead of treating individuals in isolation, population health management pushes system to look at whole population and long-term outcomes. Because of this shift, this is not just a technology, it is a driver of business transformation. It forces hospital, in users, and public health agencies to collaborate in new ways, share data, and redesign reimbursement models. That's why population health management is considered a key enabler for accountable care and for future healthcare economics. Now it's about stakeholder benefits analysis. One of the reasons population health management is being adapted so quickly is that it creates benefits for many different stakeholders groups. Patients get more personalized care, earlier detection of risks, and fewer emergency events. Providers benefits through higher quality scores, performance bounces, and better visibility into care gaps. Payers benefit because they can reduce costly claim, predict risk more accurately. Public health organizations gain better surveillance tools for chronic diseases, and government agencies like CMS benefits by reducing spending in programs like Medicare and Medicaid. So instead of only helping doctors or insurers, PHM support system while improvement, that's an important factor because technologies that only benefits on one group usually face slower adoption. Finally, population health management is a technology that is already moving toward full maturity and adoption in the healthcare system. When mapped to the business model canvas, it becomes clear that population health management does not change clinical workflows, it changes who pays, how value is defined, and how decisions are made. It supports the long term shift toward value based care, where success is measured by outcomes and prevention there than value. Population health management requires strong data infrastructure, collaboration between partners, and investment in analytics and care teams. But it also delivers measurable improvements in cost, quality, and population health. For this reason, population health management will continue to play a major role in shaping the future of healthcare business models. This slide includes the full APS 7 references list supporting the research in this presentation. These sources include peer-reviewed journal articles, government publications, and industry reports from organizations such as Gartner, the Commonwealth Fund, Harvard Business Review, and Journal of Medical Systems. All citation follows APS 7 formatting and full references. Thank you, Professor.